kind of the same category. So 1-2 are going to be scissors. The first scissor is called a suture or bandage scissor. It is going to be used to remove sutures, okay? I'm going to show you the next one as well, a small surgical scissor, just to be able to look for reference. They look a lot alike, right? So if they're even closed, they look a lot alike. The biggest difference, so what you want to make sure that you note is the surgical scissor has this little indentation, okay? Or this little kind of semicircle kind of cut out of it. That is going to be because you're going to put that underneath the suture to be able to cut it. The difference, so this is a suture or a bandage scissor. Our next one is a small surgical scissor, which they both look alike. Small surgical scissors are typically pointed. They might have a little bit of a curve, but surgical scissors are actually meant to remove or cut pieces of kind of like tissue or fragments or little pellicles of soft tissue within the sutures, within the extraction site. Okay, or in some cases, if it's that something is kind of still hanging on, they'll use a surgical scissor for that. Okay, so that's actually a little snipping of tissue. If you look, you can see the biggest thing that you'll see that's different is that notch. Okay, I'll walk around with this because I don't see. So see the notching there? That's your suture scissor because it's going to go under the suture to snip. Okay. Whereas these are going to be your small surgical scissors. Okay, so right there. See that right there? It has that indent. That's going to be your difference. So this is your suture, your bandage scissors. This will be your small surgical scissors. See this little indent there? So that's your suture, small surgical. You don't see these? Suture scissor, because that will actually go right under, small scissor. Okay, next, the Lachlan scissor. The Lachlan tissue scissor. Okay. This is very similar to your small surgical scissor, but it is longer. This is going to be used for removing larger portions of tissue. Okay. So small surgical scissor, Lachlan scissors. They're just longer and pointed. Okay. They also kind of curve off to the side. Straight here, okay? Next, we have the Dean tissue scissors, or the number 599. These are also going to be used for removing larger portions, but this is going to be typically for interproximal tissues, okay? Dean interproximal tissues. So a lot of these scissors are going to look alike. A lot of them are ultimately being used for the same thing, right? Cutting kind of tissue or any kind of pellicle that might be left behind. They all are also going to be able to be potentially used to cut sutures, but their primary goal is going to be removing the tissues. So we have the Dean scissors and the Kelly scissors, okay? So small teeth and tissue fragments, or small tissue fragments, Dean scissors, larger portions, okay? If you look, they look very, very similar. But one way to remember these, okay, is Kelly is small and dainty, but Dean is flexing their muscle, okay, and curved. So see how it's curved and they're bending here? So there's a flex there, okay? So Dean is flexing his muscle and Kelly is small and dainty, okay? So you can see it better kind of from the side. So Dean is curved and flexing, Kelly is dainty, okay? So Dean is here. You see that it's curved, so curved and flexing. So Dean curved and flexing. Kelly is dainty. You think Jenny came up with that one? Curved and flexing, and so that's Dean. Kelly is dainty. Curved and flexing, Kelly is dainty. All right, and that's the scissors.